Hello, Jennifer. My name is Sandy High. I'm a nurse
Hi.
practitioner student. I'm going to be doing your physical exam today.
Okay.
Have you emptied your bladder?
Yes.
Okay, we're going to start with your vital signs, your weight, and your height. So I'll get those real quick, okay?
Okay.
So you'll stand up. The scale is right here.
Okay.
130, is that correct?
Mm-hmm.
All right, or about right. And then we'll get your height. We're looking at 65 inches.
Mm-hmm.
All right, perfect. Good. All right, we'll get your blood pressure, your temperature. And I'll do with my temperature. Good. I'm going to start with the temperature because it takes a little longer. All right, we'll get it down. Relax. Get there. Tangled up here anyway. Alright. Sorry about that. So we'll just do a little. Get tight on your arm. Okay. Alright. Thank you. This is 105 over 62. We'll check your pulse next. Okay. Just keep that arm close. And I'll just check you right here. This takes a little bit, so just be patient, okay? I'm about halfway there. Okay. And your pulse is 78. And our temperature is 97.2. I'm just going to write those things down real quick. We don't have to worry about remembering them. Alright. And now we're just going to move right straight into the exam. Okay? So your head is normal cephalic size. I'm just going to feel your. I'm going to have you take your hair down for me. Okay, we're just going to kind of begin here. So take your hair down, lean forward for me. I'm just going to feel through your hair. It's soft, it's clean, it feels very healthy. I'm going to feel your scalp. No lesions, no lumps, no bumps. Alright, I'm just going to look at your skin overall. The skin looks good. And then just look up for me. Just look here. You can put your hair back in a tie for me if you would, please. Alright, so I'm going to do, the next thing will be to, I'm going to palpate your sinuses, okay? Alright. Any pain when I do that?
No.
None there? None there?
Mm-hmm.
And then none here? Okay,
No.
good. Alright, the next thing I want to do is I'm going to have you close your eyes. I'm just going to test you. When I touch you, just tell me where I touch you with this, okay? It's just a little 2x2.
Left forehead, or left cheek,
Mm-hmm.
right forehead,
Mm-hmm.
right cheek,
Great.
and chin.
Perfect. Good. Thank you. So now we're going to, if you'll do me a favor and just kind of relax your jaw, open your jaw. Good. And I'm feeling for your temporal mandibular joint. And close it. Any pain with that?
No.
I don't feel no clicking or grinding, so that's good. That's normal. So close your eyes for me and kind of look up this a little bit. I'm going to feel your lacrimal area. Alright. No swelling or nothing there. Alright. Open your eyes and look straight up. Look up. And then I'm just going to pull down here. Your conjunctiva is pink. Sclera is nice and white. Your eyes are even. Your ears are even. So all that's normal. Okay? So we look really good so far. Alright, so now we're going to do a little reading test. Okay? And This is called the Romberg test, and just cover one eye for me. Okay, and then just read this line for me.
Boom and oil train stalls.
Perfect, and then cover the other eye, and then read it backwards for me.
Stalls, trains, oil, and boom.
Thank you, very good. Okay, so the next thing we're going to do is we're going to go through a series of, that's your optic nerve that we're checking there, and your visual acuity. And then the 2x2, we were just checking your facial, trigeminal, and facial nerves, and they're intact. So now we're going to test your extraocular, your abducens, and your trochlear. Those are just eye muscles. Okay, so in doing that, there's a couple tests that determine that. First one, I'm just going to check your peripheral vision. I want you to cover your left eye, and I'm going to cover mine. And when you see my fingers, let me know.
When?
Okay, when you see them, yeah.
I see them.
Okay. You see them?
No.
Okay, sorry.
No.
Okay, good. We'll do the other eye. Same thing.
No. No. No.
Good, very good. All right, the next one is going to be the 6 cardinal fields. So if you'll just look straight at my nose and then follow my finger with your eyes only. Okay. Good. When we do this, you have like a little nystagmus. Your eye just kind of just slightly wiggles. That's just something to note. Nothing terribly abnormal, but it's something to note. Okay. And now we'll examine. We've done all that. Now we'll examine your pupillar reflex. Okay. I'm going to turn off the light for that. All right. Here we go. Little light shining in your eyes. I'm going to do what they call direct and indirect. So direct is just looking at that pupil, and it's constrict, and watching it constrict. And that one, and they do constrict. And now consensual, I'm going to look at the other eye as I do this one, and it should constrict as well, and it does. And same on this side. Okay. All right. Next, we're going to do, close off my thing here. Next, we'll examine the inside of the eye. Okay. If I can get this on, we'll do that. I'm gonna check for your red reflex to start with. All right. Get my little thing set up here first. Distance. Here we go. Okay. So I'm gonna step in a little bit here. All right. Your red reflex. Present. Okay. And then I'm gonna go a little bit deeper now. Here we go. You can see your vessels. Excellent. You can see your optic disc. And it's yellow and creamy. Lines are, and no abnormal lines around it or anything like that. We're going to do the other eye. Same thing. Okay. Dial up to get my thing set here so I don't have to. Alright, I'm a little close here, I know. Vessels, I can see. Down. Good. Alright, thank you. Same on that side. Your optic disc is in place. And creamy yellow, no problem. Your vessels look good too. No narrowing or anything like that. Okay. Your eyes being done, I'm sure you feel relieved. I'm going to move to your ears. Okay. So the first thing I'm going to do is walk through a whisper test. So I'll whisper from behind you. A combination of letters and numbers, and you just repeat them. Okay. Okay.
W32.
Perfect. Be on this side. Oh, shoot. A little out of view, but
2B3.
perfect. Thank you. Alrighty. So with that done, now we're gonna do the Ryan test. It's a hearing test, and the Weber test. Okay. So I'm gonna ring this, place it on your head. You tell me whether you can hear it or not, in both ears, equally.
Okay. Yes.
Okay. Equally, right? Okay. I want to do this one. I'm gonna ring it. You touch your bone back here. You tell me when it stops.
Stop.
Okay, and tell me when it stops here.
Stop.
Perfect. Okay. So we're gonna do the same thing on this side. Your mastoid bone, we'll place it. This is bone to air conduction. It's testing your acoustic nerve.
Stop. Stop.
Okay, good. Your bone to air conduction is good. All right, perfect. Good job. So with that done, I'm going to examine the inside of your ears. Okay? Okay. Let me grab my little thing here. All right. Okay. Turn it on. All right. You ready? All right. And then I'm just going to look inside. Oops. Sorry, honey. All right. Your pearly gray tympanic membrane, got nice light reflection, no cerumen, and your canal is clear of any kind of lesions or anything. All right. Yeah, here, just turn for me. Perfect. And do the same thing here. And pearly white, nice light reflection. Great. No cerumen. Perfect. Good. Alrighty, so that takes care of the ears, and we'll move right on to your nose, okay? Your nose is midline, your septum is midline. I don't see any problems. Can you do me a favor and plug one side, snip, and plug the other side? And does that feel equal? Mm-hmm. Good. Alright, I'm going to use a little light here and look up inside your nose, okay? Alright, so if you'll just lean back for me. Perfect. The turbinates are no swelling. I don't see any redness. No drainage on either side. And again, your septum looks midline. Okay? So we're doing great so far. Now we're gonna, now we'll examine your mouth. Okay? And we'll start by, should have kept my light in my hand, shouldn't I? We're going to start by I'll have you open your mouth and we'll examine that side, okay? Alrighty. Okay, good. Now open wide for me. Alright, and then just say ah. Good. Good. Your soft and hard palate move together like they're supposed to. Your uvula is midline. It lifts as it should. I don't see any lesions or anything like that. I'm going to examine the rest of your mouth. And while I was there, I see that your tonsils are still in place. Is that correct? Mm-hmm. Okay. All right, now I'm just going to kind of look around the rest and just look for anything else that might be. No lesions, no redness. And I see that your molars are out. Is that correct?
Yes.
Okay. Can you do me a favor? Open your mouth again and then lift your tongue to the roof of your mouth. All right, good. And then to side. All right, good. And this is good. Thank you. This is checking your like your hypoglossus nerve, your cranial nerve, your glossal nerve, and then your vagus nerve are all tested with that procedure. Okay. So with that said, we will move into. I want you to. There's a series of things I'll ask you to do. Can you close your eyes tight? Great. Can you raise your eyebrows? Good. Can you clench your teeth? Good. Can you stick out your tongue? Perfect. And can you puff out your cheeks? Good. And that also tests your facial nerves. Okay? All right. And then so now we'll move into your neck. All right. And we're just going to palpate for your Nodes. And I'm looking for certain. I'm going to stand this to the side here a little bit. Cervical. Can I get you to move over here just a smidge? Thanks. There you go. Perfect. Yeah. So cervical. I don't feel anything there. We're going to go post-auricle. I don't feel anything there. And pre. I don't feel anything here. Alright. And then we're going to go retropharyngeal. Nothing there. Submandibular. Submental. Good. Anterior. Cervical. Posterior cervical. Supraclavicular. Subclavicular. Good. Now can you raise your hands above your head for me? We're going to go ahead and do your axillaries. Good. Nothing there. Alright, and then just relax. And I'm going to do your epitrochlear. Just relax. Nothing there. Good. Perfect. And here, same. Good. Looks great. With that done, we're going to move into looking at your thyroid, okay? And checking your thyroid. Alright. Just relax you. Kind of relax. There you go. I'm just going to displace this and feel here. Here. I'm not feeling lumps or lesions here. Okay. Your trachea is midline, which is good. We're looking for that. And then we're also going to do your, I want you to shrug your shoulders. Sorry. And then try to push your head into mine. Hand. Good. Head into hand. Good. Then try to turn your head. Good. And turn your head. This checks your spinal accessory nerves. Mm-hmm. All right, and they're intact. So now I'm going to listen over your carotid and your thyroid. Okay? All right. You're just taking a breath and hold it. All right, good. Breathe. Sorry. Taking a breath and hold it. Breathe. And just breathe. Very good. Okay, perfect. All right, now with that done, we have I'm going to finish inspecting your skin. Sorry, there's a little hesitation there. I'll finish inspecting your skin, just overall. And just going to, so you got a little scar here. Mm-hmm. Okay, what's that from?
Ulnar nerve clipping.
Okay, like a decompression type thing?
Mm-hmm.
Okay. Nothing there. Legs, capillary refill is good. Excellent. Just going to do your feet real quick. Capillary refill is good down there. I'm just going to feel your pulses real quick while I'm here. All of that's good. Your radial, your brachial, your +2, which is normal. You good? Great. Okay, so now I'm going to move into doing your chest. All right. So if you could do me a favor and kind of turn that way just a slight bit, I appreciate it. Thank you. And then so now we're gonna just do a little. I'm sorry, my sinuses are in bad shape here. Sorry about that. We're gonna do some. I'm just gonna do what they call it. Can you turn just a smidge bit more? I know it's hard to do. I'm sorry. So we're gonna do expansion here, lung expansion. So if you're just taking a deep breath for me. Good. And they expand equally, so that's great. And then I'm gonna lay my hands on you. I want you to say 99.
99.
Good.
99.
It's tactile parameters.
99.
Good. And with that, you the vibration is equal, so nothing going on there. And the next thing is going to be I'm going to do diaphragmatic excursion. I'm going to do that and then I'll listen to you. Okay? So, I'm going to go from an area of And identify, there's your scapula, area of resonance. I'm just going to kind of lift so I'm getting skin to skin here. Dullness, no mark. Okay, I'm going to do the other. I'm going to come up from the bottom and do the same thing. Area of dullness. Area. Okay. Good. And now this side as well. And move your sports bra a little bit. One more place. Good. Alright, that's our first spot. And then we're going to come up from the bottom. And mark here. Diaphragmatic excursion should be 3 to 5 centimeters. Let's see where you're at, okay? You're right at 3 on both sides. 3 on both sides. Good. So that's normal. Now I'm just going to listen to your lungs now that I got you sitting this way. Okay. Just taking a deep breath. Good. Deep breath. Again. Just let me know if you feel like you need a break. Okay. Now we're going to listen here. There's one thing here. Listen to the front. If you'll turn around for me, this will kind of wrap things up anyway. So, all right. Deep breath. And again. Again. Sorry. And again. And again. Good. Okay. Thank you. All right. Now I'm going to listen to your heart. Okay. Aortic. Melodic. Second melodic. Tricuspid. And then mitral. And looking at you, I don't see any JVD, like jugular distended veins or anything like that. So that's also good. So now I believe we can move into the abdomen. And when you lay back, I'll listen to your chest once, and then we'll do your abdomen. Okay? All right, so you can go ahead and scoot back if you want. Might need to go a little further. Yeah, just so you're comfortable. Are you comfortable? Mm-hmm. Okay, good. All right, now I'm just going to bring your britches down a little bit. All right, good. You got that ready. And I'm just going to listen to your heart one more time, okay? And I can see laying down you don't have any JVD this way either. Okay, so I'm just going to do the same thing. Listen to your aorta. Pulmonic. Second pulmonic. Tricuspid. Mitral. I hear S1, S2, and no murmurs, nothing there to be concerned about. Okay, so now, so now with the abdomen, we'll move on to that. With that, we're going to just inspect, do a general inspection. I don't see any bulging or veins or anything protruding. That's it's nice and flat. And so then we're going to, I'm going to listen to all 4 quadrants here, and your vessels of your abdomen. Okay. Good. Active. Broad zones. Good. All right, now I'm just going to listen to your aorta, over your aorta, over your renal arteries. over the iliacs. And your femorals. I don't hear any breweries. I think everything's good there. Okay. So now we'll just do a little light palpation. Make sure there's nothing else going on here. No bulges, no belly. Nothing there. No pain when I'm doing that.
No.
Okay. Now we're gonna do a little deeper palpation. I'm gonna see if I can locate your spleen, your liver, and your kidneys. Okay. You're gonna take in a deep breath for me and let it all out. You can't feel your spleen, which is not unusual. That's good. It's not inflamed or unusually big. It should be non-palpable. Your liver, same thing. Nice deep breath. Let it all out. I can feel the ridge of your liver just barely, which is normal. It's firm, smooth. Don't see anything wrong there. Okay? And now I'm going to check for your kidneys. The left side, usually not palpable because it sits up so high in the abdomen. We'll see by not palpating it. It means it's not enlarged. So, okay. And then on this side, same thing. But the right side you can sometimes feel. I believe. I can feel it. I don't feel anything there abnormal. Okay? So now we'll go ahead and we'll percuss. And the percussion is done to note the size of your liver. Okay? So, and I need my little marker again. So, just set this up here out of the way. So I'm just going to take and go from an area of tympani down here where I know to an area of solid. That tells me that dull is the base of your liver. A little dot, little mark. I'm going to go from an area up here, resonance, to an area of dullness, which will tell me the top part of your liver. Okay? A little hard to do, isn't it? There we go. Found it. And the distance should be anywhere from 6 to 12 inches. Not inches, centimeters. So with that, we are right at 8. So you have normal, from percussion, you have normal size liver. Okay? I'm putting my little tools away here. And so with all that done, I'm going to have you sit up. Okay? Just come to the edge again. All right, we're just about wrapping this up, Jennifer. Okay? So with that done, we're going to do your reflexes and anything else that is required. All right. So I'm going to check your brachial reflex. All right. So just kind of relax that. I'm trying not to remind myself to. Now keep in mind you got that scar there. Okay. So just relax. There we go, right? Oh yeah, sorry. Okay, good. So normal reflex there. Relax. Good? Mm-hmm. Got it, didn't I? Okay. And then we'll do your reflexes. Okay, good. Okay, good. And then just the foot. We're going to do your deep tendon down here. There we go. All right. Sorry. Beating on you here. There we go. Okay, good. All right. So, I believe that concludes our video. All right.
Okay.
And thank you for participating. I appreciate it.
Thank you.
You're welcome.